We are about to delve into a subject that not a lot of people really want to talk about. It is Colorectal Cancer Awareness Month, but it's very important, and the American Cancer Society reports that that particular cancer is the third most common cancer diagnosed in both men and women here in the U.S. But did you know that it's one of the most preventable cancers?
So joining us this morning to talk more about this disease is Dr. Sukeshi Patel Arora, a gastrointestinal medical oncologist from UT Health San Antonio MD Anderson Cancer Center. Good morning.
Good morning.
So, doctor, how is colorectal cancer detected, and when should men and women start getting screened for it?
The best way to detect colorectal cancer is with a colonoscopy, and the best age to start for most people is 45 years of age.
And tell us a little bit about some of the risk factors and what symptoms should we pay attention to?
So unfortunately, in most patients, when the cancer is small, it's undetectable and there are no symptoms. And so a screening colonoscopy can help. But we look at risk factors such as age, weight, inflammatory bowel disease. Family history can increase the risk of colon cancer, as well as smoking, diet, and lifestyle.
And tell us a little bit, we hear that patients with colon cancer are getting younger. Why do you think this is happening?
You know, that's a big area of research for all of us because we're not really sure why we are seeing so many younger patients with colon cancer. Some of it may have to do with our lifestyle and diet. With the Western diet, sometimes we have more processed foods and a higher diet full of meat. And so we think that may be contributing, but we don't really have a good idea, and it's a big area of research for us.
Doctor, talk to us a little bit about the symptoms that we should be looking for.
So if you have diarrhea or constipation, blood in the stools, any changes in your bowel habits, fatigue, you are losing weight and you really don't know why, abdominal pain or bloating, then that's a time to talk to your primary care doctor about getting a colonoscopy.
And at the very beginning of our conversation, you talked about the best way to detect whether or not you have colon cancer, and that's a colonoscopy. I think that's one of the tests that gets a really bad rap because it's not an easy test to take, and a lot of people just absolutely dread it because of the liquid that you've got to drink and the way you feel. So how do you convince these people who are really on the fence about taking it because of that they need to go ahead and go through it and get this thing done?
Well, since a colonoscopy can detect polyps or precancers that can be removed before they become cancer, that's one of my selling points. And I also say that, if we can get this out early, we can avoid things like chemotherapy, radiation, and even surgery. And those can be a lot more tougher to deal with. So that's my main point when I'm talking to patients about a colonoscopy.
So you ignore the part about that really bad drink, that really bad tasting drink? Is that?
Yeah, there are newer formulations now. So a lot of the gastroenterologists will talk about different formulations, even pills and so forth. But, if the colonoscopy is really not for you or you cannot get one, then there are other alternatives like stool tests and so forth that your primary care doctor can talk to you about.
Well, that's perfect. So now there's things that we can ask about before you just go and get, I guess, the regular drink that you normally are issued.
I've had 2 colonoscopies. The second one was better than the first one because they kind of changed the formula and the way you did it, but I'm still looking for the cherry flavored kind or something. They got to keep working on that. But it's very important that you go ahead and get it done because that early detection is so important. Right, doctor?
Absolutely.
All right.
All right. Well, we hope to continue to get the word out. Thank you, Dr. Arora from UT Health Center, the MD Anderson Cancer Center, for joining us this morning.
Thank you for having me.
All right.